eye movement desensitization. Oh gosh, I've forgotten what EMDR stands for. Oh goodness, let me just Google this. All right, hello and a warm welcome. Dr. Syl here. I'm a junior doctor from Australia, and I'm on the psychiatry training program, becoming on the road to training to become a psychiatrist. I'm a doctor that works in the psychiatry field as a registrar, which is kind of like a resident in the States. And today we're doing a reaction or review of this footage with over it's got 1.7 million views, and it's about bipolar rapid cycling. So I guess we'll start with just a quick overview of bipolar disorder. I've talked about it a lot in other videos. Please check them out if you want more context. And we can talk a bit about rapid cycling, which is a interesting term and concept and important to note. And then we can look at the footage. It's about 8 minutes long, and we can share some reflections. I've seen little snippets of it, and he's from South Africa. And we'll talk about it. But in terms of bipolar, let's talk about that for a second. It's the highs and the lows to a point that causes significant dysfunction. It's not, a mild mental illness. It is a very serious diagnosis, and the lows are horrible depressive episodes, weeks, months, and it's got all the depressive symptoms. Issues in appetite, sleep, mood, motivation, eating, drinking. It's pretty bad. And actually, most of the bipolar illness is usually depressive episodes. So much so that often treatment-resistant depression or difficult to treat depression is sometimes conceptualized as maybe this is a bipolar illness that hasn't yet had a manic episode. So we would start to, if someone's had a depression that's not responded to treatment, we might start treating it as if it's a bipolar illness to see if that works. And sometimes it does. So yeah, most of the time is depressive episodes, but you can also get manic episodes. In fact, to fulfill the criteria of a bipolar disorder, you need at least one manic episode. And a manic episode is not, switching from a depressed mood to really happy, really sad again within minutes. A manic episode is days. Okay, it's actually more than a week technically, according to the DSM, but it's not something you can kind of, you wouldn't be able to act a manic episode out because you'd run out of energy. It really is a hyperactive, toxic brain state with neurons firing far too quick to the point where thought form can become completely disorganized because it's going so much quicker than someone can speak. And oh gosh, the decisions people make when they're in manic states can ruin their lives. So it gets very romanticized. People talk about, oh, I wish I was manic, it feels great. And that's true. Some people get a euphoric mania, but more commonly, or at least what I see in hospitals, is an irritable mania, where there's an anger and a frustration that no one can keep up, that they've got to work on their, incredibly important projects, that they've got to invest their money, and people have lost their life fortunes in mania. So it's a really serious illness, and I've been studying for a big exam and been reviewing the mood disorder guidelines from the Australian College of Psychiatrists, and they've actually not included the term hypomania anymore. So really, from a doctor's point of view, that's not a helpful term. The question is this mania or is this emotional dysregulation? So if people are going from highs and lows very quickly, that's more likely in keeping with emotional dysregulation. The other distinction to make is there psychosis, because that changes the treatment. Now, if it's emotional dysregulation, that can be that can be a very disabling and difficult illness as well, and usually it's part of a personality disorder, for lack of a better term, but it's very responsive to therapy. And bipolar, by the way, also needs psychotherapy and has a very good evidence base for the social rhythm therapy, which is really good for it. But in emotional dysregulation, usually dialectical behavioral therapy is a good place to start as well. There's really good evidence there. Wow, I'm sorry. I always want to just give a quick overview, and then I end up talking for I don't know how long I've been going for. 5 minutes or so. Anyway, that's the quick overview of bipolar. I guess it's hard to summarize such a complex and significant illness quickly. So when we talk about bipolar disorder and we use the term rapid cycling, that's a term. it kind of just means things are not in control. The definition is that someone's had more than 4 mood episodes that can be either depression or mania in a year. So they've had, so I guess that might not feel that rapid to some people, but that kind of just says that the illness, these significant mood episodes, are happening quite frequently. Those mood disorders still need to meet the criteria of a mood disorder. So it has to be 2 weeks of symptoms in a depressive state and 1 week in a manic state. Yeah, that's the term we use. And it kind of just means we need to pick up our socks and get on top of this thing. We need to get, this is a very important concept I learned from a great psychiatrist I worked with, is you need to get ahead of the mania. You need to get ahead of the psychosis. Now, some people don't want their mania treated. Some people like it, and if they're not posing a threat, then to themselves or others, that's their choice. People can make choices I disagree with, so be it. But if there is a risk of harm to self or others, or misadventure, like if they're running across the street because they believe they won't get hit by traffic, well, then we have to start enforcing treatment, and we can talk a bit about treatment in another video. If you're interested in that, leave a comment down below. Remember to like and subscribe. Let's begin looking at the video.
Hi, I thought I would film the state of bipolar that's called, or the symptom of bipolar that's called rapid cycling. Now, rapid cycling means basically that.
I like to stop early on just to get a bit of a snapshot. In psychiatry, we do things called mental state examinations, where we assess how someone's mental state in a cross section as objectively as possible. So can't really tell much off the cuff, but he's got a buzz cut. He's a bit disheveled. He's got the towel hanging on the wall to dry, and the rest of the room seems okay. I laugh because I guess I don't really like the color of the wall, but that has nothing to do with, I guess, a mental state examination. Sorry, that's my personal, that's my non-objective side coming through. So that's good. Got to register that and park it away. But it's got good lighting of the shot, actually, to get that kind of side on lighting, adds depth. He's got a clean t-shirt on, and just in the first couple of words, you can kind of feel he's not manic. He's not shooting off with an intense ramble. There's a bit of facial expression there. So let's keep watching and see how the mental state goes. Also, side note, Herman, thank you for sharing your footage online for people to connect with. The comments are full of people who have had bipolar illness and who find his videos helpful, so that's very positive.
Cycle between depression and mania in a relatively short period of time. It can be anything from a few months to a few weeks or even a few days, or in extreme cases like I'm experiencing today, what's called ultra rapid cycling is when your mood shift from depression to mania to depression to mania within the space of 1 day. Now, you have absolutely no control over it. There's no external thing that's causing it. It's due to whatever process is in your brain is causing this. It's usually treated with mood stabilizers. I am on mood stabilizers at the moment, but sometimes they just don't work, and today they're not working.
So interesting. I guess the first thing to say is ultra rapid cycling bipolar is not a formal term. I've never heard it used. This is the first time I've heard it used, and it's based on his definition more fulfilling what I would call an emotional dysregulation. There's absolutely no reason, and it's very, very common to have a dual diagnosis with emotional instability and bipolar. There's nothing as effective as as dialectical behavioral therapy, schema therapy, or mentalization based therapies, the kind of therapies for emotional regulation. And so, with respect, Herman, I probably wouldn't call it that based on those descriptors he's just talked about. But it's good news, really, because it really it does respond to therapy. I guess a key thing to not let happen is some people say I've got schizophrenia or I've got bipolar disorder, and so therapy doesn't work, so I'm not going to engage. So I need medication. And it's like, well, yes, those are very serious illnesses and they do need medication, but don't let that get in the way of therapy. Therapy is great. We all need it. But when you have a serious mental illness, it's critical, and there's very strong evidence bases for psychotherapy and emotional instability, even in people who have a bipolar illness, and very strong evidence of psychotherapy for the bipolar illness, even though that's an illness that doesn't, classically, well, it's an illness that needs medication as part of the treatment. But just remember, guys, this is the line I always go to: complex problems have complex solutions. So when you want to treat a mental illness, you're treating a whole human in the whole life. So it's biopsychosocial, spiritual, and cultural, and you got to have a holistic approach to this. So the someone with a bipolar illness and these kind of episodes of fluctuation in mood, they might be on the mood stabilizer to help with the episodes, the mood episodes, but that wouldn't necessarily be important or helpful in emotional instability. Now, that's to the best of my knowledge. I've been working in healthcare for, I don't know, more than 5 years. I've been in psychiatry just over a year, and I've worked with some of the best, psychiatrists and have studied for big exams and stuff. So that's the level of my knowledge so far. It does happen though that people's experience is inconsistent with what we study, and or what the textbooks say, because as they say, the textbooks do not read. Uh, Sorry, the diseases don't read the textbooks, and our models are all about trying to characterize the illnesses based on what we see. But based on just saying that mood goes up and down over half an hour, I wouldn't call that ultra rapid cycling. I don't think that's the right use of that term in a clinical professional sense.
So many people don't know what it is like to rapid cycle. It's very tiring. It's very confusing because you don't really know how you feel. The one moment you're okay, the next moment you're not okay. The one moment you're okay, the next moment you're not okay. So
So when I describe, I guess just what I'm noticing is that tone, intonation in his voice and facial expressions. When you talk about depression, it is a heterogeneous term. There's a lot of different subtypes of depression, and in terms of the severe kind of neurovegetative depression, where people speak little, and the blinking is slow, and the body is slow, and movements are slow, and there's no eating, and actually the sleeping is, they can fall asleep okay, but they're waking up at 3 a.m. and just not able to fall back asleep. That kind of neurovegetative depression. I get melancholic kind of depression. This doesn't look like it's one of that subtypes. It definitely feels like a very cognitive depression where he's feeling flat. Let's keep listening to some of the symptoms he gets.
it's a very confusing and tiring and difficult to explain state. So I'm filming this so that people can see exactly what it is about. So first, let's start with the depression. At the moment, I am feeling depressed. Um, I'm not in the mood for anything. I don't want to eat. I'm not hungry. I have no interest in Facebook. I've got no interest in doing anything. It's that stare at the wall feeling, and nothing really makes sense. Um, Many people, when they are depressed, they sleep. I can't sleep. It's as if though it makes my depression worse. Um, so the only real thing that I can do is I need to ride out this wave, the roller coaster as we call it. I need to ride it out. Um, so the possibility exists that I'm going to be manic soon. I'll film that again, and then you can see the shift from the depression into the mania. Okay, it is now about 7 minutes later. My mania has not increased.
I've never personally ever seen mood episodes swing that quick. I've seen emotions and kind of swing that quick. So yeah, I guess another term we haven't talked about is cyclothymia, which is kind of another term to fill this middle ground area between having mood episodes and having kind of lower intensity, lower, like it's not as serious a depression and it's not as serious a mania. Cyclothymia is kind of a mild bipolar illness. Um, but yeah, this kind of rapid changing of emotional states is yeah, not how we would use the term rapid cycling in Australia. That's all I can say. I can't diagnose anything here, guys. I'm not sitting down with Herman and spending an hour talking through the symptoms and clarifying different things. I guess what I can kind of say is I haven't seen any evidence of psychosis so far, but which is just a very important thing to note whenever someone's presenting with any depressed or elevated mood. And that's a common thing people don't know about. You can definitely get psychotic with a depression with psychotic features, and it's pretty high risk, especially if it's an agitated depression. That's another term we haven't talked about. So mixed states where people can be both depressed and manic at the same time, and it just looks horrible to be in. People are like trying to jump out of their skin. They have depressed cognitions, depressed mood, but they're speaking at 100 kilometers an hour and distracted and tangential and having flight of ideas, and they're very high risk of self harm. So those are people you have to maybe treat in hospital. Um, so anyway, let's keep listening. He's definitely described common symptoms of depression, but if they're fleeting and they're happening within kind of 30-minute to 1 hour episodes, that's probably something that will respond well to emotional regulation based kind of psychotherapy.
What's happened is my depression has worsened. I am now extremely depressed. I That's all I can say is I am really depressed. I hope that the shift will come soon. Um, Dealing with depression is not a very pleasant experience. It is now about 15 minutes later. Um, I am feeling irritable. Now, one of the telltale signs that mania is starting to happen is you getting irritable. Sounds are getting amplified for me. Um, my eyes are getting sensitive to light. A lot of people with bipolar experience this. When you mania increases, your eyes become very sensitive to light. Your your hearing becomes heightened. Um, Everything seems louder and sharper, and everything seems to irritate you. For me, it's the sound of a phone. If a phone rings now, probability is that I will either put it on silent or smash it against the wall. So I'm definitely starting to cycle again. Um, I will film again in a few minutes if the mania does increase or if I go back to depression. Okay, it is now about half an hour later. I'm feeling better. I'm definitely either manic or hypomanic at the very least. My speech is the speed of my speech is increasing. I had a shower, I had a shave. I'm feeling much better. Um, Sometimes the mania can increase so much that I become euphoric. Um, in other words, it's so intense that I even become lightheaded. So I'm going to wait and see.
Just, I guess, a couple of observations and points that Herman has talked about. First of all, he's shaved. Did you notice that? He's changed his top. Definitely agree that his affect has changed. His speech is a bit more rapid. His expression is a little bit more expansive. It's not this. This isn't mania from a strict psychiatric perspective. If you can sit down, film a video, be sensible in your speech, and function. That would be more in keeping with a hypomania. Uh, mania usually ends up in hospital or jail or worse. So mania is a very kind of it's quite often very disorganized state, and this is still quite organized state from what I've seen. Right, I'm not. Sometimes I sound more confident than I should. I guess just based on what I'm seeing, this is how I feel about it. Um, so let's keep watching. I guess the other thing to say is euphoria and lightheadedness should be probably treated as separate terms, because I think Herman is describing euphoria as a sense of lightheadedness, um, and uh, and it's probably best to separate those terms, because lightheadedness could be because of dehydration, because you haven't been drinking, and then you have a blood pressure drop, and then you faint. Euphoria is probably just a really positive mood, and people feel that in different ways. So just a point there that the term euphoria is a term we kind of, well, I don't know if it's not actually a technical psychiatric term. We use the term euthymic, which is when someone is kind of a normal positive range and reactive mood state, and then elevated. Uh, Sometimes I think I have seen euphoric written down in a couple of notes, which is probably, as you described, just a really positive feeling, and often the term is described as expansive when their mood and actions and they look bigger than life. So that's the other term that's used commonly.
In the meantime, I'm going to clean. That's something that a lot of people do
That's a
when
good
they are
use
manic.
of
They
time.
clean a
Yeah,
lot. It's I don't know if it's to get rid of the excess energy or to occupy their minds. I'm not entirely sure.
a funny thing I heard the other day is that cleaning is the poor man's EMDR. So if you haven't heard EMDR, eye movement eye movement desensitization. Oh gosh, I've forgotten what EMDR stands for. Oh goodness, let me just Google this. EMDR therapy. Yeah, yeah, desensitization and reprocessing. Whoops, I had an exam just the other day, so I probably should have known that, but I had a mind blank just then. Sorry. So EMDR, eye movement processing. EMDR, eye movement desensitization and reprocessing, is essentially when you do a talk therapy and usually go through a trauma whilst in intervals doing a left right with your eyes on a therapist's hand, and just kind of talking about what your brain's doing when that's happening. And the no one really knows why it works, but the evidence is pretty compelling that it's good for trauma therapy. And your brain kind of does funny things when your eyes are occupied going left to right. The thinking is that going left to right probably occupies the cortex, which lets your limbic system, where the emotions are felt, kind of engage in whatever it has to engage in and process what it has to process, while blocking out the defenses of the cognitive higher level stuff. Anyway, the reason I bring all that up is that some people have said that cleaning is the poor man's EMDR. Because what do you do when you clean? You're scrubbing and you're looking left, right, left, right, left, right, left, right, left, right. You're occupying the cortex so that your deeper brain structures can have a bit more freedom to express themselves without your defense mechanisms managing the anxiety so intensely and stuff. So I thought that was a funny analogy, but that could be a benefit of cleaning. Obviously, when you're manic, you have such high energy that it's just you using the energy that you have.
Okay, it is now about 45 minutes later. I'm definitely manic. Um, I have a lot of energy. I am feeling on top of the world. I can do anything. I have a lot of ideas in my head. I'm writing. I'm in between. I'm cleaning. I'm doing the washing. I'm like,
I guess this is we should, I absolutely respect Herman's, Herman can express himself however he wishes. That's fine for him to call this manic. I guess all I'm saying is that from a psychiatric diagnostic point of view, um, the term mania, it has very strict, it's a very defined term, and it's not just based on how you feel or what you're doing. It's based on like a psychiatrist's evaluation of the symptoms you've got and the length they've been going on for. So it's distractibility, insomnia, like a sense of grandiosity, bad decisions around gambling, infidelity, breaking the law, losing your money, that kind of stuff. Um, Speech really fast to the point where it can get to word salad, and uninterruptible, often pressured. So you just can't get a word in. You can't get a word in, and it doesn't stop for days. It's got to be at least 7 days according to the DSM. So days, like sleeping 1 to 2 hours maybe a day for 7 days. So it's a very toxic brain state. Needs intensive acute treatment. Often, sometimes, well, not often, but not infrequently, it needs ECT, electroconvulsive therapy, if it's medication
But
resistant.
outside that I was scrubbing, and so I am definitely manic. Now, the thing about this is why I wanted to film this so that you can see it. This is not just it. This entire process is going to repeat itself throughout the day. The way I'm feeling now and the way you saw me at the beginning of the clip, that's going to alternate during the course of the day, during the course of the next few days until I stop rapid cycling. Now, I'll have to admit I did have coffee. Coffee does or can increase your chance of becoming manic. A lot of people experience this, so I need to avoid coffee. Another thing that I absolutely have to avoid at this stage is alcohol. If I have to drink now, I will experience psychosis, which means I will have a loss of reality. I will hallucinate. So, one thing that you really, really have to avoid when you are rapid cycling, when you are bipolar, is you need to avoid alcohol and illegal drugs because it is really going to increase your
Definitely agree with all this.
and it is going to worsen your depression. So that's basically it. I just wanted to show you the process from going from depression into mania, and that's it. That's what happens. For some people, it's much slower. For me, sometimes it is slower, but my rapid cycling usually is ultra rapid cycling. Like today, it's very fast and it's very tiring. I'm not looking forward to the next depression one, but it's going to come. And I will deal with it as I always deal with it. So I hope that educated you a bit, and I hope yeah, you now have a better understanding of what rapid cycling is about. Thank you for watching.
Yeah, so definitely agree. Drugs and alcohol can just make everything worse. There's no real shortcut to it. That any kind of stimulants can make a mania worse. And I've definitely had people with severe caffeine intoxication. 20 cups of coffee a day, strong coffees a day, and they're using up all the instant coffee sachets on the ward, and it's very, very common. So coffee can be a risky thing in mania, um, and any kind of stimulant can make mania worse. So your brain is plenty stimulated enough. It's a good idea to cut down, and alcohol just gets rid of any kind of cortical and sensibleness you have. You got that frontal cortex, which is where sensible decisions get made. And alcohol just is a GABAergic drug. It just cuts that off basically, and you're all limbic, and your limbic system is essentially seizing in mania. It's hyperactive. It's going. It's not a seizure. Don't get me wrong, but it's a very hyperactive state. So any kind of cortical modulation and kind of executive function you can preserve, you should keep. So drinking alcohol loses that. So very important to avoid it. So I think Herman has some really good tips there. Really interesting video. Definitely gave us a lot of content to reflect on, and was a good opportunity to talk about how, from a psychiatrist's perspective, how we use the terms. Sorry, just clarifying. I'm not a psychiatrist. I'm in the training program to become one, and I'm still just 2 years, 1.5, or just over a year in. So making my way through the training program. I just feel like I have to qualify that because I will be a psychiatrist one day, along with I pass all the exams, but I'm not there yet. So hopefully that's still very helpful, and I found that really, really good to watch. So I'll leave it there and wish you all just a beautiful day. And I would love it if you guys leave a comment down below, and I will try and answer. I enjoy making videos where I go through the comments. So if you're okay with that, ask any questions you've got in the comment section, and I'll go through them and answer them in other videos. I find that fun to do. Cool. All right. Like and subscribe. See you in the next video. Bye.